one of our, for us, is a hero in Belize. This is a young man who has earned gold medal for Belize. And to earn a gold medal in Belize is very important because you're putting your country, on an international agenda, and he did that. So when he developed a mental illness, the association that he belongs to asked me to please write them a letter in order for him to be taken outside the country to the United States. I didn't think that I needed to do that because I knew I could treat him here. I'm trained and we had everything here to treat him. It was very interesting because I remember after when he was coming to the clinic, the first time he came and he was back on his bike, everybody was so glad, so surprised to see him getting better, which is a good message to show people that mental illness can be treated, and then we can treat people here in Belize. And that has meant a lot to Belizeans.
With support from a new non-profit mental health advisory board, funding from grants, and assistance from the Pan American Health Organization, Belize has taken huge strides towards bringing mental illness out of the shadows. Its innovative approach trains people in the community to extend the reach of mental health services. And it brings treatment not only closer to home, but often in the home.
Due to the lack of psychiatrists in Belize, so they had to develop a program where they were training nurses that give them the skills to diagnose patients, treat them within their community. That's very innovative because people don't have to be traveling miles and miles to come and seek a psychiatrist within the city. We have a psychiatric hospital where we used to have over 120-something patients. Today we have less than 50 patients in the hospital, so we have decreased our inpatients because of the presence of the psychiatric nurse practitioners.
Along with the social worker, we do home visit and we go into the home, we assess the patient, we see how long they are on the treatment, if the treatment needs to be changed, if it needs to be increased, decreased, we talk with the relatives, see what problem they have, how much they know about the illness of their loved one. And then this will give them a better opportunity to know how to care for the patient at home.
There is love there, you see. You don't treat one more than better than the other, you treat all of them together. And that's what counts. Love. You see, if you turn away, if you treat this one better than the next one, well then, what would it be? You say you care for that one more than you did not that. You got to know how to handle each and every one.
Well, Mr. Woods, I am very happy because there's not all the time do we have family support, and you are very outstanding.
Thank you very much, ma'am. Thank you. I appreciate it too.
Every time
Patients not only receive medication and counseling, but many may also participate in occupational therapy. Psychiatric nurse practitioners also give advice on nutrition, child rearing, and budgeting, all of which are stress factors that interfere with recovery.
How you think the psychiatric clinic, how you think that helped you?
A lot.
Is that a great support to you?
Very, very,
Why?
very much. Because I learned a lot. I mean, you tell me about the different ways I could behave without the medication and why the medication is important. And I've learned a lot.
We know that the vegetables and the legumes and all of these are good for the nourishment of the brains, because some of the things that causes mental illness is, nutrition. So, and I know, well, right now you are getting your injection every day, your vitamin Bs every other day. But I'm glad to see that you have this up. You use this?
Yes, really.
So whenever you get your next income from the States, or yes, then you come and visit me, and then we go to the Belize Bank, and we start to put an account there. If you're not feeling well, you can come back on a Friday to see the doctor if you wishes, or if you have any problem coming up, you could still come back to see me.
Another thing that is becoming innovative for Belize now is that since we're seeing an increase, and some of our patients are they get better, they get well, they go back to their job. So we had developed a consumer association, people getting together to discuss their issue.
I see you work, I see you get along on the street, I see you get along with people. You're wonderful people, just stay on just stay on your medication. That's all you need to do. Stay on your medication.
Thank you for that.
I think the support we give each other and the way we accept one another has a lot to do with recovery. And we can always talk and get in touch with one another. I can always call the nurse or call anybody, and we're always there for each other.
We try to put a little bit of mental health in anywhere we go. If we go on the radio, because sometimes we do radio shows, we go on the radio, we talk about mental health and mental illness. So we are trying to create a bigger awareness about it, and we hope that the stigma will decrease, I believe.
So you're saying you get good family support, and you also get support from the government too.
Yeah.
That's nice.
It has taken the work of a forward-looking government, a dedicated group of psychiatric healthcare workers, patients and families, and caring volunteers. Although far more support is needed, Belize has created a mental health program that is making a tremendous difference for the country and offers great hopes for the future.
We want to see a health services that is universal, that is efficient, sustainable, high quality services, and where equity is one of the main components of the service. Where people access the services based on the needs and not on the ability to pay.
I'm hoping that for while we're doing this will probably bring more people out and to seek help. I know that we have a lot more people who are suffering, and they're suffering in silence, and there is no reason to suffer when there is help in Belize.